I am joined now by Jared Antczak, who is Chief Digital Officer at Sanford Health. He is in Chicago for the Becker's annual meeting this week. Jared, great to have you here.
Great to be here, Courtney. Thank you for having me.
What is the dialogue taking place in the world of digital health strategy and some of the conversations you're having?
It's definitely a hot topic here at Becker's. A lot of sessions talking about digital strategy, digital transformation. Spoke on a panel earlier today where I talked a little bit about the difference between digitization and digital transformation, right? Sometimes we interchange those words or think that they mean the same thing, but they're very, very different. And that's something that every health system is grappling with and trying to figure out, how to ensure that they're getting the biggest value, the most bang for their buck out of their technology investments.
Now, I learned you just wrapped up a panel on consumerism as a health system strategy. Jared, talk about what that means.
Yeah, consumerism is another big buzzword right now that's happening in the industry, and I think it's interesting because you don't think about consumerism. If you go to other industries, Target or Amazon, they don't talk about consumerism. They just talk about their consumers. And I'm hopeful that one day we'll get there as an industry as well, where we can just talk about the people that we serve, as consumers. And I know that word in and of itself is sometimes controversial or a little bit provocative because we're talking about our patients. The reason I like consumer is because it's a broader term. It's not just our patients, it's also our members from our health plan, our residents from our long-term care facilities at Good Sam, as well as care seekers in the community that we may not even have a relationship with. The patient experience really focuses on that pre-visit, visit, and post-visit experience. If we start thinking about the people that we serve as consumers, we start going much further upstream and downstream from that encounter and creating that relationship and becoming relevant in people's lives, even in between the times that they are sick. And to me, that's where healthcare really becomes a lot more powerful and valuable as a resource for people and becomes relevant to their lives, is when they're thinking about how do they manage their health and how are they enabled and empowered to manage their health in a proactive way, not just thinking about their doctor when they're sick.
Yeah, such fascinating insight. Thank you for that. Now, as a large health system that serves 250,000 square miles, Jared, two-thirds of our patients live in rural areas. How important will it be to get technology investments right when it comes to serving those who are typically underserved?
It doesn't matter if you have the most sophisticated mobile app. If somebody doesn't have a smartphone or they don't have internet access, it's not going to provide any value into their lives. And so, from my perspective, it really comes down to digital equity. And it looks at things like, what is the device availability of a particular population? Do they have mobile phones? Do they have tablets? Do they have, computers with cameras embedded? What does their internet access look like? Do they have broadband access, or do they have cellular coverage where they can access the internet? What is their digital literacy like? Do they feel confident and comfortable downloading and registering and navigating through an application, a digital experience? So we really want to make sure that we're thinking about those factors when we're picking the right technology that will ultimately serve our patients and making sure that we're meeting our patients where they're at.
And as a digital leader, Jared, at Sanford Health, what are your checkpoints when deciding whether or not to implement new technology?
As I think about, the digital experience, it all comes down to people. And, whether those people are our consumers, our patients, our members, our residents, or whether they're our caregivers. And by caregivers, I use a broad term to mean our physicians, our providers, our APPs, our nurses, our staff, the people sweeping the floors in our facilities. All of those people have different needs and expectations. And how are we meeting those needs and understanding those opportunities and problems in a meaningful way? I think all too often it's easy to get caught up in chasing a new solution, with the shiny bells and whistles, but really understanding our problems that are important to us as a system and that are important to our patients and our consumers, and starting there to inform which solutions will ultimately meet our needs the best is really, I think, the number one checkpoint that we need to become a little bit more sophisticated and mature about as an organization in terms of implementing some discipline.
Jared Antczak, Chief Digital Officer at Sanford Health. Appreciate your insight and leadership as always, and of course your time from Chicago at Becker's. Thanks so much, Jared.
Thank you, Courtney.
For Sanford Health News, I'm Courtney Collin.